Hi viewers, greetings from TechSci Research. We have started a series of podcasts where we discuss on topics which impact the general population. I have today with me Dr. Manthan Mehta, to whom I am going to ask questions on the impact of AI on the healthcare industry. So let's get started. Dr. Manthan, thank you so much for joining us. And it's our pleasure that you are here to answer a few questions from our side. But I start shooting questions to you, can you just introduce yourself and your work in the field of AI in healthcare?
Sure. Thank you so much, Alvin and the team for having me here. And yeah, I'm an offbeat doctor trying to be a cool doctor. Let's put it that way. So I'm a physician by training, and started my career with academia research. Moved on to consulting for startups, and then into the pharma industry. Worked with large pharma, then moved into health tech with digital therapeutics, and now with the AI hype cycle, I'm building something in AI in healthcare. Over the time, what I understood right from the time where I was practicing clinically to seeing problems at the system level, that healthcare needs a lot to be done. And, unfortunately, health tech has more tech than health in it. And you have, with all due respect, you have a bunch of technically very, very sound and brilliant people trying to solve problems in healthcare without having a healthcare professional or somebody from the healthcare system into it. And that's why there are adoption challenges, a lot of issues fail, a lot of apps go unused, and a lot of doctors have friction with technology and systems there. So we are trying to bridge that whole entire gap, and we believe that the ecosystem has doctor patient relationship as really key, and within that everything else is an allied and supporting partner. And with today, with how AI works, I think it's become easier to bridge that gap, which was ever widening. We're trying to narrow it as much as we can.
Okay. See, everybody's been hearing about the word AI. I think even a kid on the road will or a vendor will also tell you that they have heard about AI. But AI's role in the future of medicine, what is it that excites you the most?
Yeah, no, I really like the way you said that, everybody is talking about AI and even kids have it. Just a couple of weeks later during the summer holidays in my complex, I'm going to be teaching kids basics of AI. So I think, while we have all these events and podcasts and other webinars for the elite audience and professionals, like you said, it's a buzzword everywhere. My maid also tells people that Bhaiya is doing something with a fake brain. Yeah, I think what excites me is not the future, it's actually the present. Today, if we see the capabilities and the way we are harnessing AI, and let's look at a patient journey through and through. One is early diagnosis, right? Screening, trying to pick up diseases early, trying to do a predictive kind of an analysis to say that, hey, you know what, just you did a routine X-ray today, and we could pick up that you will probably develop, a severe lung cancer 10 years down the line. Or we did an ECG today, and it shows normal. Of course, it's normal, but with the AI algorithms that we've put in place, it shows that you'll probably develop a heart attack in the next 3 years. So that level of screening, predictive analysis to start with. Then, once you probably get the disease, that's where you need personalized care, personalized treatment, where it is exactly tailored to you. The way today, if you look at quick commerce, you look at e-commerce, you look at OTT platforms, you see exactly, what you want, right? Based on what your past interactions were. Mm-hmm. And that level of personalization is very important in healthcare. Today, I joke around with my other friends who are doctors and tell them that you give very generic advice to the patients, right? That, don't eat junk food, exercise 30 minutes in a day, don't take stress, take your medicines on time. And it's like a road script. And, the patient has 100 other questions and challenges that they are facing. And that's where, personalized treatment, we've been talking of personalized medicine for the longest time. I think for at least for more than a decade, I've been hearing that as a topic in every medical forum that we go to. But AI will make that a reality. It'll make that a big reality. And then comes the post care and the entire system and support that it provides, right? One to the patient, and also the administrative burnout that doctors get, and the entire healthcare system, which is very overburdened with fragments, with siloed approaches, too much paperwork, too much of all other elements which eat up into your crucial time, right? And that's something again that AI is trying to bridge. So these are our key elements. And one more very, very key aspect, particularly from an Indian standpoint, is healthcare equity and access. Today, we live in a dichotomy in India where we have medical tourism, we have the best corporate hospitals in the top cities where people across the world come to get treated. And at the same time, we have rural India where people, walk kilometers to get even basic healthcare access. And that will change, because the technology adoption in India is very quick. If we look at digital payments, if we look at social media and all those elements, we have the maximum smartphone users in the world. And with AI powering that, the need to get accessible, affordable healthcare will also change.
Okay. So currently, how is AI being used in healthcare? I mean, I understood that you can predict what's going to happen with you 2-3 years down the line. But currently, what is the status of AI in healthcare, and can you give some kind of real world examples also?
Sure. So today, a lot is being used in terms of variables and the data that comes from there, and trying to give you predictive outcomes. Right. Two, it is heavily being used in screening. We have large companies like Cure AI and many others which actually are working in the space of screening. So diagnosis, basically, radiology and pathology are two domains where a lot of AI is used. And to put it very simply, AI runs on data, right? On what you feed it in, and that's what's going to make the algorithm and do the training. And these things are easily accessible compared to your clinical decision support and other elements within the Indian healthcare system, where you don't have unanimous or uniform data around that. So these are places where it is being used a lot, right? That's the core of where it is used. Two is augmenting telemedicine, augmenting other projects that governments are doing, right? Even with ASHA workers and all of that, where door to door kind of public health initiatives where technology has taken place, and they are augmenting that with AI. Right? Three is, of course, in administrative places like AI scribes. Lesser used in India, but mostly places where EMR adoption is higher. Their AI is being used significantly to reduce that healthcare burden. And four are, I think, very evidently being used in the form of chatbots everywhere. Right? You go on different healthcare websites, different websites of scientific literature, learning, etc. That's where it is used. Broadly, these are four places where it's used. Fifth, I think, is a lot of open AI kind of usage when it comes to solving certain questions, or trying and probing out, or trying to learn and understand more. So what used to generally happen by reading and deep research and a lot of literature search online, that is being simplified, and that's where again AI is being used, to the extent that medical editors and journal editors have guidelines now in terms of where and how much AI have you used, and you need to disclose it. So these are broad places where it's being used. Bits and pieces are being used everywhere. So, when people ask about how AI is being used and when will it actually become a part of your daily life, every day, bits and pieces are getting integrated into our daily life without us understanding. So, I'm sure you can relate to the smartphone revolution when it happened, and we didn't realize where the entire world came into our phone, from just something basic to today, you don't need a wallet, you don't need identity cards, you don't need anything. So it's just that way, daily bits and pieces are getting integrated in healthcare without us actually realizing how much the impact is.
Okay. So tell me one thing is, can AI help in overcoming certain challenges? So for an example, doctors for a number of patients all over the globe, except in certain countries, is very less,
Right.
right? Per doctor, and the number of patients is very
Correct.
less, or access to care.
Mm-hmm.
Can AI help in that?
Absolutely. I think access to care is one of my pet projects or favorite areas where AI can help. And we see that skewed relation between doctor and patients. And when I talk about the use of technology, it's not about telemedicine or putting the doctor in front of them. It's rather empowering allied health professionals, where you have nurses, you have pharmacists, you have grassroots level healthcare workers, medical social workers who can actually get AI based reporting in terms of either be it the blood tests, be it any of those investigations, be it their way of understanding how the human body is working or the symptoms and all that comes in, summarizing it in a way that the doctor understands in a very very simple way, or probing in terms of even having that conversation with the patient. While doctors are trained for years in terms of history taking and arriving to diagnoses, uh, these allied health professionals, if they get AI prompts on that, if the patient is complaining this, you should ask this as the next question, and this is what you should probably do next. So that kind of empowerment of whatever healthcare related professional is available at that region, at that point of care, is somewhere where AI can actually change that access and equity. And then of course it comes to the doctor at a later stage. So say places where you don't have CT scans, you don't have MRIs, you don't have all of that. Imagine screening tools which can pick up things from an X-ray, pick up things from an ECG, pick up things from a sound analysis, and can give you very good, like at least 95% and above kinds of accuracy, which can then just go to the doctor in terms of doubt for acumen, that we don't think it looks like this, but AI is very strongly suggesting this, then can you look into that? So instead of reporting 100 reports of which say 95 are normal and only 5 needed my attention, I can now focus only on the 5 because the remaining 95 have been done. So that's where, in terms of access, in terms of bridging that doctor patient ratio, I think AI and technology has a tremendous potential.
Okay. So in that respect, any technical or regulatory challenges that you see?
Yeah, I think when we talk of AI, right, and my core area of expertise within AI is also around ethics. The entire ethics of AI and the guardrails that you maintain. There are going to be challenges, right, in terms of data leak, in terms of cloud hosting, where the data is going. Patient sensitive information is something which you have to handle with a lot of care. A lot of doctors are privy to a lot of things that patients do in the confidentiality of their relationship. The moment you bring in a third party, in terms of technology, in terms of artificial intelligence, there is always a scope for leak, right? We always say "Diwaro ke bhi kaan hote hai" type. So you always have that scope for leak, and these challenges come up, and that's where guardrails are very important. Very important to have sandboxed environments in terms of technology, where whatever is going to AI is de-identified. Whatever is coming back to you, is again getting re-identified in a process where the technology is not involved. So having these layers is very important. There will be regulatory ethical challenges in terms of who is to blame, right? If a doctor does a misdiagnosis, you can sue the doctor for medical negligence. The doctor can be penalized. If AI makes a mistake, who do you penalize? Do you penalize the doctor who has used AI? Do you penalize the AI company that has given a wrong information? You don't know. Or do you penalize the government for using AI? So that ambiguity is still there, and I'm happy in the way that our country is taking a lot of leadership in providing ethical frameworks, talking very strongly about it. So while everybody is in that rut and race of developing LLMs and developing large AI models and structures, we are taking a very different approach in the country, where we are looking at the ethics around it, and whether we're going to do the right thing or not. So we can train humans to take the Hippocratic oath and say do no harm. We have to get AI to do the same thing, and that also requires similar amount of training, similar amount of guardrails and framework, where we stop thinking that it's going to do magic, right? Magic can also have a black magic part.
So now tell me, one is where you predict or you diagnose an issue. Second is the data security aspect. Are there any associations or government bodies who are looking to regulate in all such things?
They, I think recently the government announced in terms of having an AI council and then AI centers of excellence, which will probably work on it. Today, it is overlapping with multiple structures where AI is being used in healthcare, whether it forms as a part of software as a medical device, whether it becomes a med tech kind of a thing, then that goes to the regulators. In India, to CDSCO, across the world, different regulators like FDA, EMA, and whatever regulatory bodies the other countries have. That's where one part comes in. Then comes the entire element of the data security and breach, where you again have the IT Security Acts, you have the Data Protection Bill today, which again oversees this at a high level. So it works at various intersections where you have ISO technical kind of regulatory compliance that you need to follow. In healthcare, you have the healthcare HIPAA, GDPR, and local regulations and compliance that you need to follow. Then come the drug regulatory compliance, wherein if the given intervention is changing something, is actually intervening and bringing or changing outcomes in a patient, changing the health status of a patient, then that needs oversight by the regulatory body which looks at drugs and medical devices to have this also as one component of it. And then you have the apex bodies, like you have the bills that have been passed by the parliament. So currently it's more like it's fragmented in that way where you don't have one seamless system that if I'm developing an AI system, this is one window where I need to really reach out to, and then the same window will put me in different places. Today we are doing the reverse. Today we have to go to different places, and then they'll be like, no, this is healthcare domain. You have to go here as well. Then you have to go here as well. Rather than that, I think a single window, single framework across the country and across the globe. So it will, because the use is not going to be so restrictive just to a company. For example, when we use multiple AI agents in something that we are building, we use multiple LLM models which are placed in different countries and then fine tune it. Now, we may be compliant to the Indian regulations in many, many ways, but then compliance to those elements, that because we've used that or we are hosting it in a different domain. So currently the regulatory frameworks works mostly on hosting, where you are hosting the data and what is happening to data through and through. But we need more global surveillance on it and a more unified approach across the world so that people can build somewhere. We keep hearing this in a lot of AI events that we are not getting the relevant regulatory support, and that is turning sometimes as a deterrent to people that you don't know what will happen. A lot of people tell me that when you are in a very regulated environment, tomorrow the government changes one policy and we don't know how it will impact. So having that standardization, uniformity is very important.
Okay. Now tell me one thing is how accurate or reliable currently is AI in healthcare?
So we cannot generalize it, but AI follows a simple principle of GIGO, which is garbage in, garbage out. So if it has been trained on the right data sets, it helps. Accuracy levels, they get tested, and reinforcement learning, all of that happens. The level of accuracy improves over time in terms of the way the data sets get trained, get reinforced, get used in the real world, just like human intelligence, right? You probably start learning maths when you are 3 years old. You probably just identify numbers and do little bit. Then you start evolving till you do trigonometry and differentiation and integration and all the complex mathematical problems. AI works in a very similar way. It's just the replication of the way intelligence works, and it takes time. It takes time to develop that. In terms of accuracy, one other point I would like to highlight is data bias. See, a lot of AI models are trained either on synthetic data or trained on false data, and we had a interesting study from the FDA where we realized that most of these models are either trained on synthetic data or trained on historic data, which may not be very inclusive. There is a lot of ethnic racial bias also in many data sets that are trained. A lot of radiology data sets are trained on Indian population and then being used across the globe because it's cheaper to acquire imaging and other data sets in India. So that kind of biases exist across, because some systems have better reporting of data. Some systems permit them to utilize that data for AI training. Some systems don't permit to use real patient data for training. So it's all based on the data set it is trained on, and accuracy claims, again, those need to be very, very regulated in terms of where and how much are you claiming accuracy for. Like the way we have accuracy, efficacy for drugs being regulated, I think a similar yardstick needs to be applied in healthcare AI, where you are regulating it, that you are 95% accurate, and that has to feature in terms of a label or a certificate, like you have an ISI mark or something, that you are certified that you are right most of the time. So we're not there yet. So in terms of evolved in terms of the framework, but most people are working quite well in terms of accuracy, and I think a lot of responsibility lies on people who are developing and using AI to make sure that they're not launching something which is not accurate.
Okay. Just a thought came into my mind. Since we spoke about records, so AI automatically learns, improves, right? Its intelligence. Like you said, using records of, let's say, India and trying to predict in some other world. Don't you think there could be some kind of bias or some kind of misreporting, because my body structure will be totally different from a European or a US citizen's body structure, or my lifestyle will be totally different. So what I'm consuming may predict that, maybe 3 years down the line, I may have some kind of a disease which may not work in some other country.
Absolutely. That is a very, very fair thing, and that if the data is not trained on it, it doesn't help. And that's where transparency is very key in terms of AI regulations, where you transparently say that, this has been trained on these data sets or trained in this geography and this population. When you Indianize context, and that can happen today with AI, where you can contextualize it in a different geography, where you say that this is how it is, but it will not give you an absolute accurate thing, because it's a variety of factors, right? There are many confounding variables that play. It's not a language text or something that may not differ across countries. The human body is very varied, and you can only be accurate to a limit, right? We generally say medicine is more of an art than a science, because a lot of it is variation, right, within every body and every person. And these kind of, that's what I came alluded to earlier, that the data sets which are fed, if they are biased, all the output is always going to be biased. So that transparency in reporting of data sets is key.
So doctor, tell me one thing, is like in other industries they keep talking, AI will replace human beings, etc., etc. Do you think there'll be same thing happening in the healthcare, that we'll have a lesser number of doctors, or will it be a tool in the hands of doctor that will help them to diagnose patients much more easily?
So this debate, I think, keeps coming up everywhere, that AI will replace doctors, AI will not replace doctors. Of late, I'm hearing people have relaxed on that front a little bit, thinking it will not, and it won't actually. It helps in augmentation. It is a way where a lot of us say that AI is not just artificial intelligence; it's augmented intelligence, where a lot of memory-oriented tasks, a lot of admin-related tasks, which are repetitive, which are monotonous, which can get really easy and simplified. Your administrative burden can significantly reduce. For example, something that we are developing, which works in terms of giving support to patients beyond the clinic. Imagine a doctor, seeing 100 patients, and then each patient even asking one query a day. How much time actually goes into that, right? So these are the kind of things where it will help you be with the patient by not actually being there with them. So those support tools will come in, those support systems will come in. It will help you predict things, it helps you summarize things, it helps you do a lot of things. I mean, with using AI, I've been able to read research papers at 3x the speed, because you don't it cuts through all the fluff and tells you. And then if I really like something, and I feel this looks weird, I need to really deep dive into it and see what the analysis actually looks like, I will only go to that. Otherwise, whatever prima facie it, summarizes in a way that you want it to. So it saves you a lot of time to do work which is more meaningful, right? AI cannot really give you the right differential diagnosis. It cannot understand that pulse of the patient, right? It can tell you that your heartbeat is abnormal or your BP is high, but it will not be able to predict that, oh, it's probably because I'm asking you tougher questions, or I'm pinpointing you that you probably didn't follow the healthcare advice that you I had given you earlier, or just because it's a heat wave in Bombay and you've come to the clinic at this hour and it's obvious that you will probably have a little high BP, or you've not hydrated yourself, etc. So those nuances can't come. AI can solve your medical entrance exams, it can solve all of that, but it can't give you those nuances which because a doctor patient relationship it can't develop, right? It can tell you objectively what it knows from books and literature, and every reply is going to be very bookish. It will probably pick up one rare differential diagnosis which I may not remember, but that's not what you expect to do. I mean, you always taught that you have to think of the more common things first in healthcare, and that way it can just assist me that if something really goes missed and a rare disease or a syndrome which has not crossed my mind can cross my mind again as a support tool, but it cannot replace, because you cannot replace the human touch in healthcare, because healthcare needs care and AI can't give care. AI can do empathetic responses, which it can trigger and write and play with language, but it can't care for a patient.
Okay. What kind of advancement do you see in the next 5 to 10 years?
Hard to say. 5 to 10 years is a big horizon. I don't know how a year will look like. Like, we didn't know DeepSeek will come in, and when one language model becomes so many language models, we can't predict the next year probably in AI of how it's the pace at which it is moving, and it's quite rapid. I think the next 2 to 3 years, the cycle will is still on a rise, and it will do various things in healthcare which we are looking at. One is we'll see AI driven drugs which are discovered and through AI and then getting approved, like clear discoveries from AI. We'll see personalized healthcare at an extreme level, in terms of from your genetic profile to some screening to whatever you've done, straight out of science fiction movies. And if the brain on a chip, etc., starts working, I mean, we've already seen some progress in on that front. Maybe that is also another element that will work drastically in terms of AI changing that and changing the way future works. We'll see, multiple AI agents which are working in healthcare, simplifying the journey at every step for different people. We'll have AI pods in rural settings in across. We are already having healthcare ATMs in certain states where India is piloting. I think we'll have AI pods where that can happen. We'll have AI integrated probably into urinals in public washrooms, where China has done a project where it's picking and predicting and giving you a lot of things, genetic profiling, and you being exactly targeted to that. And with that will come all its own perils as well, where you don't know how much AI knows about you. You don't know how anxious you will get by knowing more than what you should know. Just today morning, there is an article in the newspaper which talks about how wearables and the data coming from there is causing a lot of anxiety in youngsters, because of the same things that I spoke about, right? It just looks at values, whether it is normal or not normal. It doesn't look at why and gives you all the vague things. So, knowing everything, there is this wonderful book by Eric Topol, who's the editor of Medscape, where the patient will see you now, which talks about democratizing healthcare data, giving you complete information from your genetic profile to risk predictors. In 5 years, you will get heart disease. In 10 years, you will get cancer, etc., etc. But what it gives you today probably is a lot of anxiety. Sometimes ignorance is bliss. And with that advancement that AI will do, I think I want to keep it very balanced, that these are also some side effects that it will bring with it.
So, doctor, just on the variables part, I just wanted to ask you quick two questions. One is, will AI give me my historical data also?
No, AI depends on what you feed. So unless it is fetched and that open integration is possible, which I don't think a lot of people do today, you need consent from various parties to integrate those APIs and integrate and do that API calling to bring your data in. So, but with intelligence that your smartphones are developing today, and the way data is stored there, and then if that gets consented, it can work. So it cannot fetch by its own till there is consent from all sides. If there is a variable which is working on that front to bring in all of your information tomorrow, probably with ABHA and the digital health mission and all that thing, where everybody becomes a digital footprint in healthcare and gives you through and through data, eventually it will probably happen. So like I said, in the future, you don't know how much AI will know about you.
Yeah. So another thing, the variable aspect. You have a variable, it gives
Right.
all the indications of your body, sends it to the doctor. So let's say all my indications are real
Yeah.
time being sent to my doctor, and he immediately suggests to me what am I supposed to do if something goes wrong. Uh, is it working currently, or is it something which is going to happen in the next few years?
There are devices which are working on that front. It's not through and through. They are more isolated and siloed. Like you have CGMs, you have ECGs, you have wearable heart monitors. You have all of those which are working today. But that going to the element in terms of one single chip, say, putting the whole human body and bringing it on a single chip, and that processing everything and generating data all the time, from in real time and continuously, will be too much of data generated as well. But the problem with that kind of a system, which we in the healthcare community discuss amongst doctors, etc., is sometimes it's too much of a data dump. Not every piece of information is relevant to the doctor. So what works there is, one is generating that data, then having a system which makes it and insights which are digestible, small chunks and pieces for the doctor to take action on, and understand that behavioral pattern, or understand that pattern of uh, various bodily parameters and vital signs, and then see where action is needed. So the problem today with wearables and other things is there is too much information, too much data, parts of which not comprehensible to the general user. Doctors don't trust today's wearables so much because the margins of error are quite high when it comes to doing vital signs. Yeah, there are good technologies in terms of facial scans, predicting BP and predicting blood sugar, glucose, etc. But then come with their own variations, right? I'm sitting in a very brightly lit room. My facial camera scan is going to look very different if I probably switch off the lights. So, minor variations in those things exist, and they've not become mainstream today. The use of wearables has gone significantly up, and everybody wants to milk on data. And when you sign up on wearable devices, you knowingly or unknowingly give access to a lot of your data. So the correlation of that data, the insight that get generated from it, and then to make it actionable to the healthcare provider is a big loop. So it's getting generated very quickly, but what to do out of it and make actual sense of it is where the future lies.
Okay. What advice would you like to give to medical professionals or students who want to embrace AI?
I think those who want to embrace AI, the advice is lesser. Those who are not embracing AI, my advice is to embrace it first. Uh, there's no use shying away from technology and advancement. It's there for your betterment, right? I mean, when banking went completely digital, now I don't remember the last time I visited a bank actually, right? With UPI transactions, I don't know when I went to an ATM earlier. So things will change, and if you don't evolve, you are going to get a lot of difficulty. For those who have embraced AI, coming to your question, I would say strike a balance. Over reliance or over dependence is also not good. AI gives you very structured responses, very beautiful answers, gives you very different things which you may not have seen. But You can't rely on it fully all the time. Human oversight is very critical. So keep a balanced approach. Don't rely completely on AI. Also, don't always defy AI or go against it, saying no, AI doesn't know anything, only I know what it is. Do what is in the best interest of patients, but learn it, learn technology so that technology doesn't manipulate you in any way, and you can do the best for your patients. So, those who are embracing it early, I think early adopters will always do better, but it's for everybody and it's not as difficult as it looks like. There is a lot of jargon around it, but for your basic working and what you really need is to understand and interpret it. And as medicos, you all have the aptitude to do great analysis. Your mind analyzes the human body in the best possible way, and nothing is more complex than that. So don't shy away from it. Don't think it's very very difficult. Just see how to interpret it, how to analyze it, but keep it balanced. And in the end, do no harm to the patients.
Right. Any final thoughts on how AI is going to change the face of medicine?
I think I'm excited to see that whatever you imagined and dreamt of medicine to happen in the future, uh, whenever you wrote a fiction story about it, read a fiction story about it, all that is going to become reality. And we just have to hold and stay really really excited about this whole journey. It's a phenomenal journey, and it also, with all this great power magic that AI brings, there is a lot of responsibility that as a healthcare community we should act, because I always tell this: there is no sorry in healthcare. You can't delete. A mistake done can cost a life. So that responsible use of things is what we should do. But the future is something that we've not imagined. I can't even sit here and tell you what it will look like, but it's right out of a science fiction movie or a story where it's organ on a chip to probably predicting what your thoughts are doing and giving you a second conscience. We don't know where AI will take us.
Okay. Right, doctor. Thank you so much for your time. It was a pleasure talking to you.
Thank you so much. Same here.
Sure. Thank you so
All.
much. You
Thank
take
you.
care of yourself.
You too. Thank you. Bye.
Bye-bye.
AI in healthcare. That was so interesting. We'll soon come with another interesting podcast. Till then, stay tuned with TechSide Research.